I'm Matt. I'm going to be your nurse today. Could you give me your name and date of birth?
Josh Williams, 5/30/91.
Perfect. Can I check your barcode here? All right. Scanned it, and everything looks good on the computer. So, Josh, are you here for a head-to-toe assessment?
I am.
Perfect. So I'm just going to ask you a few questions here. Make sure you're oriented ×4. So it'd be person, place, time, and situation. So again, could you give me your name real quick?
Josh Williams.
Okay. And then do you know where you are?
At the clinic for an assessment.
Okay. And then are you aware of the date?
Yeah, May 13th.
Okay, perfect. And then the situation, do you know why you're here?
For an assessment.
Perfect. Okay, so his level of consciousness also seems appropriate. His eyes are opening spontaneously upon approach or touch or sound or any of that. The conversation is a normal pace and rhythm, so there's no abnormalities there. And now we can go ahead and get his vitals. So I could do temperature with the oral under the tongue. It'd be about normal range would be 97.9 to 99.1. I could go ahead and get his radial pulse. The pulse range would be 60 to 100 would be within normal range. And then his respiratory rate, 12 to 20 is normal range. And then SpO2 greater than 95% is normal range. Blood pressure, wrap around here. And then pumping the bladder up. The normal range would be about 90 to 60. And the high end would be 120/80. So I would be listening for the brachial pulse, and then as I deflate it, the first number would be the systolic, and then the second number would be diastolic. And then I can go ahead and do a pain assessment. So we're doing PQRST. Are you experiencing any pain right now? If so, can you rate it on a scale of 0 to 10?
Yeah, some pain in my wrist. I'd probably put it as a
2, okay. What brings the pain on?
Mainly lifting stuff that's like over 5-10 pounds.
Okay, and then quality of pain, you said it was a 2?
Yeah, it's kind of dull.
Okay, I was going to say, is it sharp, dull? Okay, so dull pain, and then the region, area the pain's at,
the wrist there.
Wrist, severity, that's a 2, and then the T is PQRST for pain, the time the pain occurs.
Just whenever I'm lifting.
Okay. All right, so we can go ahead, do the head-to-toe assessment. When we get to the wrist area, we may do a bit more focused assessment, testing some of the range of motion parts and that. So I'll let him leave it. Oh, and also on normal vitals, he's 5'11", so normal weight range between 180 to 210 is within normal. And then 19 to 25 for BMI is considered that normal range. So now I can go ahead and do the head-to-toe assessment. I'll let him keep his hat on for this one, but the hair is evenly dispersed. It's appropriate moisture, texture. It's not overly moist or abnormally dry. He doesn't have any lesions or rashes on his scalp. Going down, looking at the face, his eyes are equidistant apart, normal cephalic. I can test Perla with the pen light. If you can just follow the light here. And we can do the 6 cardinal gazes, making sure his pupils are equal and reactive to light. Also, we can go ahead, have him open his mouth and stick your tongue out there. Make sure the uvula is midline of the palate is even, so everything looked good there. And then going down, we can go ahead and test skin turgor. So basically you're just pulling, making sure the skin goes back in place and doesn't pinch out for too long, otherwise it signifies dehydration of the patient. So he looks good on that. Skin is appropriate for race and age. Going down, we can test cap refill here, so we want it less than 2 seconds. And again, that's testing oxygenation, so everything looks good there. We're continuing to go down. I can listen to his breathing through the lungs, 5 on the front, 9 on the back areas. So Josh, if I can just have you do a deep breath in and out. All right, and then we'll do that. Same thing, breath in and out. All right, I can listen to his heart sounds. I'm listening to the apical pulse. I'm listening for the S1, S2 sounds. And so I'm just going to listen to your heart here real quick, Josh. Okay, so everything sounds good there. Going down, if I can have you lay back real quick, I can listen to the abdominal area. So I'm going quadrant to quadrant. And here I'm listening for the bowel sounds, making sure they're normal active, or hypoactive, or hyperactive. And we're gonna go clockwise, starting in the left upper quadrant, going to the right upper, right lower, left lower. Okay, and we can go ahead and palpate that area as well, just making sure it's soft, tender, and not distended or... Okay. Percussion too, and then also we can go ahead, so everything looked good there. Also, if I can have you sit up real quick again, then we can do the same on your back. Just all right. So percussion for the lungs, and then we'll continue to go down. We can check his popliteal pulse on the back of the knees. We're going to do that bilaterally to make sure everything is equal. All right. And go down. Check his pedal pulses. And if I can have you take your shoes off real quick, Josh. Perfect. So we're checking for edema around the legs and ankles and making sure there's no abnormalities or lesions or rashes or erythemas. So I might go ahead and actually pull yourself back a little. Alright. Pulse there. Okay. And then I would do the same on the other side. Alright. Okay, and then we can do some range of motion exercises. Make sure, oh, before I forget, with the abdominal region, I would also check on the genitourinary area. So basically just asking you, are you urinating infrequently or is it normal urination? Any issues you're experiencing?
No, it's been pretty regular.
Okay, perfect. So now we can go ahead and do some range of motion exercises. For the head and neck area, if you can go ahead and just circumduct your head, kind of go in a circle. Are there any aches or pains with that? Okay, it seems like a fluid motion, no crepitus or rigidity that it looks like he's experiencing. For the shoulders, if you can do elevation, pushing up against the hands. All right, perfect. And then for the arms, if you can stick them out. And then for abduction, if you can push both out against my hands, pushing in. Okay, and then for abduction, we'll go the other way. All right, and then if you can grip my fingers, and we're testing bilateral strength there. Okay, perfect. And he did say his right wrist was bothering him. Were you experiencing any pain when you were doing that in your right wrist? Okay, perfect. For your legs, if you can go ahead and you get your shoes on you. If we can go ahead, we can test the same thing. Stick your leg out like that. And if you can do abduction, push away. And then abduction towards. Okay, and we can do it with the other. Abduction away. Abduction towards, and then we can test dorsiflexion for the ankles. If you can just stick your leg out and flex up like this, and I'll push down, push against, okay, and then same for the other. All right, perfect. And then if I can just have you stand up and walk in a straight line, one foot in front of the other. So here we're just testing for kind of his fluid motion, no abnormality in his gait, and then coming back, could you just walk normally? Okay, and also his balance seems appropriate, no abnormalities there. In terms of the rest of the head-to-toe assessment, I believe that covers it. So, Josh, I appreciate your time today. Do you have any questions for me before we finish up here? Okay, perfect. I think that's it. I appreciate your time and thank you very much.